Okay, so this is chapter 1 and this is part 2. Anatomy physiology. We're going to talk about the correct anatomical position and using anatomical terminology to describe parts of the body and those parts in relation to the others. So, speaking of anatomy physiology, it's like a different language. You need to know this common language to refer to the body position, direction, regions, and cavities. And most terms are derived from Greek or Latin. Anatomical position is very, very crucial in using this terminology. You need to know how to think of the body in correct anatomical position. And you can see it in text here what it is, but I'll show you the image. And this individual is in correct anatomical position. It's standing upright, face direct, face forward, palms forward, and the feet slightly apart. That is correct anatomical position. A few other terms that we'll refer to that the body a lot of times needs to be thought of, or you need to know of, is prone position. It's which you're lying on your stomach, your whole body. That's prone, and then supine is lying down face up. And you notice that the palms are up in supine there. All right. Sections and planes. Slices of the body can be called sections or planes. A section is actually when the body gets actually cut to expose internal anatomy. A plane, however, is an imaginary line that is drawn that passes through the body to give you different views of organs. And there are there's actually 4 different planes that we'll talk about. The first one's called the coronal or the frontal plane, vertical plane that divides the body into anterior and posterior. Transverse, if you take the body in correct anatomical position and you take a plane and you cut it horizontally or transversely into the superior and inferior parts. Another plane that has many different subsections, I guess, is called the sagittal plane. The mid-sagittal plane goes directly down the midline of the body and divides the body into right and left. Any other kind of other sagittal plane that's still up and down and separates the body into right and left is called the sagittal or parasagittal cut. An oblique plane is when the body is cut at an angle. And these images just show the different planes. This is the coronal that divides the body into anterior and posterior. Transverse cut divides the body into superior and inferior. There's the mid-sagittal plane, or directly through the midline. Sagittal or parasagittal is offset of the midline, still up and down, still divides the body into right and left. And then the oblique plane divides the body at an angle. More images showing this shows the 3 planes together, the 3 major planes. And the different views of the cranium, which is actually a really good thing to look at. And those are good review questions that are also in your textbook over section 1.4. Okay, section 1.4c talks about anatomic directions. And these are in opposing pairs, and so we'll go over those. Anterior is towards the front of the body, posterior is towards the back. Anterior towards the front, posterior towards the back. Superior is toward the top, inferior is towards the feet. Medial is towards the midline, and lateral is towards the outside, as you can see the arrows there. Proximal is going to be closer to the point of attachment. Distal is farther from the point of attachment. And when I say point of attachment, I mean where the limbs attach to the torso. In this area. Deep and superficial. Deep is referring to closer to the core, or the middle of the body. Superficial is more towards the outside. So the skin is superficial to the fat. It means it's more towards the outside. And these are just those terms all together, all in the same picture. It should, and this is a table 1.1 talks about these terms. and it gives you examples, which is a great thing to go over. So inferior, closer to the feet. The stomach is inferior to the heart, meaning the stomach is closer to the feet than the heart is. And dorsal and ventral are two terms that mean the same thing as anterior and posterior. So anterior is in front of, towards the front surface, and ventral is on the belly side of the human. Belly side in animals, that's why there's two different terms. But it just so happens that in humans, ventral and anterior, we're talking about the same surface. And it gives you some good examples. The heart is posterior to the sternum. Posterior is the heart is closer to the back than the sternum, which is you can actually touch. You can't touch your heart. And two other terms on here, cranial or cephalic means at the head end. Caudal means at the rear or tail end. And rostral means towards the nose or mouth. In a pig, this area is called the rostrum. And then table 1.1, continued, medial, lateral, deep, and superficial that we went over. And proximal and distal. And those are good examples. So what did you learn? The elbow is what to the wrist? The elbow is what to the wrist? It would be, what would be the best term there? Think about that. The liver is what to the skin? What would be the best word for the liver to the skin? And the mouth is what to the ear? What would be the best term for that? So think about this. 1.4D. The body is in two main regions. The axial region, and we'll talk a lot about this when we get to the bones. The axial is like anything in the middle. Your head, your neck, and then your trunk. So think of the trunk. If your arms and legs are missing, that would be your trunk. Neck, head would be your axial skeleton, axial part of your body. Main vertical axis. And then anything other than that, so your arms and your legs, would be the appendicular skeleton. And there's other smaller regions within those too. So, regional terminology, the parts of the body have regional names. For example, you can see here, your neck region is called your cervical region. It's really important to know these regional names, especially when we get to the names of bones, the names of muscles, the name of lymph nodes. In the cervical region, your neck contains your cervical vertebrae. It's also where your cervical lymph nodes are located. Antecubital is the front of the elbow. Antebrachial is your forearm. Your carpals are your wrist. Wrist, carpals are the bones in the wrist, okay? So you need to know all these regional terms and what part of the body it's referring to. Here's the back side. There's going to be some parts of the body that you can't see in the front side. And what's a good example? Your lumbar region is your lower back. The back of the knee is called the popliteal region, which is a really fun word to say. And then these are those different regions and highlighted in blue. You can see orbital, oral, nasal, mental, frontal, auricular, ears, cranial, facial, occipital, parietal, bone. It's also called that temporal, zygomatic, and buccal. Pretty much if you know all these, you can name most of the bones of the skull, which helps. And then the cervical neck region can even be divided a little bit further, but we don't need to know all those for now. Thoracic region, you can see it includes, you can be the whole thing. The axillary region is specifically your armpit area. Axillary lymph nodes are of importance, are usually a big indicator that somebody has lymphoma if they have their lymph nodes enlarged in their axillary region. Pectorals and sternal. And with these regions, you're going to find that a lot of them are going to be pretty familiar with. They're going to be easy for you to know those things. The other ones that are a little bit more abstract, you don't have anything to connect to it, like antebrachial, for example, you're just going to have to memorize it and know where it's at. If you do start doing this work now, it'll become easier the more you say it and point to these things. Again, more of the regions highlighted for you in blue. Palmar is the palm. Deltoid is where the deltoid muscle's at. Brachial is your upper arm. And antebrachial is your forearm. So the arm is divided into the upper arm, like the bicep area, and then the forearm. Lower limb regions, femoral, is where your femur is. Patellar is the front of the knee, and the back is the popliteal. The crural starts with a C there. Tarsal is your ankle bones. Pes means feet. Dorsum of the foot is the top of the foot, etc. So these are also in 1.4D in your textbook there, but they go over the different regions, questions associated with them. 1.4E. So these organs in our body are housed within enclosed spaces called cavities, and we'll talk about that in part 3. So this is the end of part 2.